Hi, everyone, and welcome to part 2 of our 4-part clinical nutrition webinar series. I'm Dr. Melissa Grill-Petersen. I just want to take a moment to thank Numedica and, of course, take a look at their disclaimer. This information is not being presented by Numedica. It is being presented by myself, Dr. Melissa Grill-Petersen, founder of Functional Medicine Agency and Inspired Health Institute, here as a clinical educator to bring you, my fellow practitioners, some wonderful information that's going to better help you to understand a functional approach to clinical nutrition as tonight we explore the microbiome. So I hope you are ready because it's going to be pretty interesting. Now, you know how I do this if you've been on any of my webinars. Want to make sure you're in the right place. This is going to be a working webinar. I advise you to have a pen and paper so you can take some really great notes because this is for you and it's going to be worth time. If you're an integrative, holistic, functional medicine doctor, chiropractor, naturopath, acupuncturist, nurse practitioner, or wellness professional that's currently practicing clinical nutrition or wanting to better understand how to address and support underlying GI issues in your patients for improved clinical outcomes. If you haven't been on any of my webinars before, then I'd love to just take a moment just to let you know who's on the other side of this microphone. It's me, Dr. Melissa. I've been in this health and wellness space for well over 20 years. I've worn many hats. My doctorate's in chiropractic. I'm a board certified holistic healthcare doctor. My master's is in science with a concentration in wellness. I have educated 1 to thousands on stages big and small, television, one-on-one, all over. And today I'm here to educate you because I have run a practice just like you for many years. And I've seen the good, I've seen the bad. I've consulted practitioners just like you for close to a decade in a multitude of environments, from literally small businesses, integrative groups, medical spas, even hospital systems. So I've seen so many trends. I've seen so many fads come and go. I want you to know that there really is a rhythm of how you provide excellent patient clinical care and outcomes while still running a really successful practice. And so I'm on a mission to help you because I believe we're all in this together. I consider you and I change agents. Really, as healthcare is changing and evolving, we've got to know how to stay afloat because patients now more than ever are sicker than ever and really need what you have to deliver. And I'm all about not reinventing the wheel. You know, success leaves clues. It's already out there. So what we're going to do on tonight's webinar is I'm going to help you just kind of key into the clues that are there that you can immediately plug and play into your practice. Because as I've been on this, journey for many, many years, and especially over the past several years, just switching from full-time practice to full-time consulting and only part-time practice, I work with so many different types of practitioners, and there's really 4 key areas that we all struggle in. And I call these the holes in our bucket, so there's always that marketing and business side. How do we actually get people into our practice, the right patients coming in, paying out of pocket, staying in care? How do we close them? What is that? How do we actually get them to pay for those services? How do we treat them in a way that will actually keep them? And what type of systems do we need to put in place to make the whole thing just work and flow and much more effortless so you don't have to have sleepless nights? So these are 4 key areas I typically educate on. And today we're really honing in to the clinical outcomes. And that's what we're doing in this 4-part series. It's all about a functional approach to clinical nutrition because remember, success leaves clues. And I want you to know what type of clues your patients are presenting with that's going to help you have better clinical outcomes, which also means greater retention, greater referrals, and greater profit and revenue, which is essential if you're going to stay in business. So we've all heard it. Hippocrates said it over 2,000 years ago. All disease begins in the gut. So what we're going to do here today is to get a better understanding of this, and we're going to reverse engineer the process. And let's think about, well, if disease begins in the gut, what do we need to do to maintain health in the gut to truly prevent disease? In case you did or didn't tune in to our last session, we're going to build upon where we left off. So last time we covered what is functional nutrition, and we really looked at the role that food plays in impacting our overall health and healing. We looked and understood it in a clearer way how food is information, and the biochemical and genetic uniqueness of each of us, and really the trends in healthcare, how everything is, moving, even as we talk microbiome today, to the genetic component and what's happening at a genetic and cellular level. So healthcare is changing, science is changing, and everything we're learning is communicating inside of the body. There's not just one master. It's not just the central nervous system anymore. It's not just the hormones are delivering a message. You're going to learn today how even the microbiomes have this amazing signaling system, much like cellular phone technology, how they can just communicate. So there's so much that is evolving and we're learning thanks to the genome projects, the microbiome projects, as we're really looking at technology about what's causing what to occur within the body. And it's essential for us as practitioners to at least, even if we don't practice that way, to at least have an understanding of the environment of that we're all, existing in and treating in and running our businesses and our practices in. So we also looked at patient-centered care, and this is what we spent the majority of the time talking about in session 1. We looked at who's coming into your practice and how do you quickly and easily identify clinical nutritional deficiencies. We talked about the intake forms. We talked about examination, physical examination processes that are just visual examination that can be added into any type of exam you're currently doing in under 2 minutes that will give you a tremendous amount of clinical insight to the underlying pathology and root causes that are at play in your patients. And then we looked at some of the relevant clinical research showing key nutritional strategies to actually improve those outcomes. So if you didn't get a chance to look at it, please watch session 1. And now we're going to springboard into today, and we're going to really focus on the GI. Because as Hippocrates said, disease starts in the gut, and we want to reverse engineer today to talk about how health can be promoted through the gut. And we've got some staggering numbers. So we are finding that more than 70 million Americans suffer from digestive disease, and it's costing, oh my gosh, look at these numbers right here. It's costing us over $100 billion in medical bills. That's just GI issues alone. Your gut, my gut, all of ours, we host between 500 and 2,000 species of microorganisms. Now, these are bacteria and yeast and parasites and viruses and fungus. This is this little community in there. And, we've been thought to think of the word of parasite or even bacteria or yeast as bad. But we're going to learn today, we're going to explore good and bad bugs. It's really not so much that there's good and bad. It's what's happening in the environment that's changing the expression. But there's what's called beneficial bacteria, and more than 85% of what's is designed to be of benefit, and it helps to keep everything working properly. And again, we'll go into that more in a few moments. 60 to 80% of your immune system is located in your gut. Now, we've all heard the gut referred to as the second brain, and that's when we realize things like the gut bacteria, actually, it's so important. So hear this, the gut bacteria creates 95% of the body's serotonin. Now, that's the feel-good neurotransmitter, right? Like that's essential so all of a sudden we start thinking about the massive amounts of depression, of anxiety. We start to think about everybody that, all these problems, these mental emotional problems that continue to rise. And really, we are the number one country. We take the largest amount of antidepressants in the world. And we also see that more than 40 diseases have been linked to bacterial imbalance. Again, this is where I'm saying depression, arthritis, IBS, even cancer. So the reality is our bodies, what the microbiome has revealed, when we look at these ideas that, our gut alone has 500 to 2,000 species of microorganisms, when we look at just within our body and we look within the gut, we realize that science shows us that we have 10 times more microbiomes, more microbes, than we have human cells. So really, we're just all big bugs walking around, right? In cute clothes and with different color eyes and hair. But that's really the reality. And so we have to start to look at this conversation. We have to start to look at who's walking into our office. Again, I'm not implying that you all become gastroenterologists. That's not what I'm implying. I'm simply wanting you to realize who's walking in, what are some of the underlying causes, what's going on, because much of this is rooted in lifestyle. It's rooted in the choices that we have that we can make or decide to pass on every single day. And you'll be amazed by the time we finish this presentation tonight how just some very small changes can make a huge, huge shift in a patient's health and well-being. Now, why does this all matter to you? Because if they're coming to you and they're not getting the result that they think they're supposed to get, then you're healing, right? So you might be doing one modality, one specialty, and yet they expect you to be able to fix it all. And yet when you can understand how health and disease, how it's so interconnected to what's happening in the gut, you can begin to make some small shifts that can have very profound changes in the care that you're delivering to your patients. Now, this is how it's showing up in your practice, right? Again, regardless of what type of specialty you are. So we're seeing things like depression, anxiety, ADHD. We're seeing tons of skin issues, acne, rosacea, eczema, psoriasis. And this is huge in kids today. My gosh, babies are coming just out, like tons and tons of children have these problems. And we'll talk a little bit more about that shortly. We're seeing thyroid issues, Hashimoto's, hypothyroidism, Graves' disease. We're seeing a tremendous amount of colon issues, constipation, diarrhea, IBD. We're seeing chronic fatigue, adrenal fatigue, insomnia, rheumatoid arthritis, fibromyalgia, headaches, all of these joint aches and pains, fevers and colds. This is how it's showing up. And where does it start? It starts in our gut. Now, by this point in time, you have probably heard the term leaky gut, and you've probably seen this very slide that's up right now. So I'm not going to go super in depth, but I do want you to understand this concept. So here we are looking at the epithelial lining of the gastrointestinal tract, all right? And so what happens, if you see over here, the tissue is supposed to look nice, tight junctures, and everything is healthy and we're good to go. And it's the barrier. It's the protective barrier from that closed tube that goes from the mouth to the anus. It just, we take food in and the whole process, it's that motility, right? That's going to assimilate or eliminate. That's what happens through that long tube. But along the tube, so things aren't supposed to get out unless they're signaled, an appropriate signal that says when and how much. Now, what comes into this terrain? Well, there are a lot of, I'm just going to suffice to say toxins right now. There's a lot of stressors. Actually, stressors would be the better word. There are a lot of stressors that come in the form of physical, emotional, chemical, environmental. So if we think about chemical, environmental, we're thinking about the foods, we're thinking about the drugs like medications, we're thinking of all the parabens and a lot of the elements that are on everything from the receipts that we have to the plastic that we're microwaving. Okay, so there's a lot of these environmental elements we're ingesting. Then there's pathogens. There's tons of pathogens. And we're going to talk about, oh, I'm so excited. This is one of my favorite topics. I'm going to tell you about this in a moment. Organ malfunctions, of course, there are the additional toxins from the environment. And so then we think stress. Well, all of these elements are inflammatory. They're pro-inflammatory. Stress, fight or flight, we got to stay alive. We got to go ahead and produce that cortisol. And of course, that's pro-inflammatory. And so what does all this stuff do? Well, it starts to really irritate the lining of the GI. Now, over time, every day these heal, but when we have a constant barrage, constantly coming in, there's not enough time for this tissue to actually recover and heal. And so over time, it wears down, it wears out, it becomes deficient, less effective, and it becomes leaky. Now, most research out there is saying literally it's become really widely known. This is a very widely known topic, the concept of leaky gut, and how we go from GI inflammation to hypersensitivity. Now we're releasing particles, releasing toxins, we're releasing mostly it's food intolerances, right? Coming into the system. They're now into the bloodstream. They're not supposed to be here. The immune system says, hey, you don't belong here. It literally goes on attack. So now this is the foundation, ground zero of autoimmunity. Because we've got system issues, because it's very hyper responsive. There are things coming in that are not supposed to be there. And the body says, I got to attack you. And so oftentimes self is attacking self because as all of this is circulating in the bloodstream, it's circulating through organs, it's circulating through glands, it's circulating through, for example, the thyroid. Okay, every 26 minutes, our blood is circulating and it's going through the entirety of the body. Now, depending on where the immune system picks up, the stuff that's leaked through, like the improperly digested gluten particle that we're eating over and over and over multiple times a day. And now all of a sudden it picks that up. The immune system finds that and says, you're not supposed to be here at the site of the thyroid. Well, guess what happens? It starts to attack. Well, not only does it attack the gluten, but now it's mistaking the thyroid as the gluten. And so now it starts to attack self. So that's a whole other concept for another time. But I want to let you know this is where some of this stuff is coming from. And it does all begin in the gut. When things start to break down from bad food, bad thought living, bad environment, then disease flourishes. And so we know from the Microbiome Project that there are 100 trillion bacteria, fungi, protozoa, and viruses that live inside of the body. Again, 10 times more of them than us. And they're incredibly beneficial. They're here for a reason. They aid in human health and biological processes, such as, and one of the big things, extracting energy from food. So let's just think about this. I want you right now to think about how many patients come into your practice that talk about fatigue. Right there, fatigue, how tired they are. And it's listed. And you look at their symptom survey and you're going to see on most people it's a 3 or a 4 or 5 if you go from like 0 to 5. So it's not just a 1. Most people, more than 80%, put down fatigue as a very viable symptom. And that is a real symptom that's giving you insight that, hey, things might not be working right inside of their body. So these beneficial bacteria in our microbiome, they also help to produce essential vitamins. They produce a lot of our Bs, guys. I don't know if you realize this, but they're really workers for us. That's why they're called beneficial bacteria. They help to regulate our immune system. They regulate glucose levels and metabolism. I'm telling you, the bacteria are such an important part of a healthy metabolism. And of course, they protect us against disease-causing microbes. So it's really a symbiotic relationship. It's, we take care of them, they take care of us, they help us to evolve, they help us to, continue to stay healthy. And as we age, as we live, our microbial communities, our inner microbiome will shift depending on our diet, our lifestyle, our exercise, our medications, antibiotics, and environmental factors. So it'll either help to improve it positively or negatively. So it's just like from lesson 1, from webinar 1, we talked about how each bite of food moves us closer to health or closer to disease. And that's very true because even the quality of food can be highly inflammatory and can be very disruptive to the microbiome. So again, it's that same type of concept. Are we going closer to health or closer to disease? Now, there's a lot of things that create imbalance to the microbiome, but at the largest epidemic, and even the CDC, if the CDC is saying we got problems, we got real problems, right? So in 2013, the research was showing that 4 out of 5 Americans receive antibiotics each year. The numbers were quite staggering, you guys. And the numbers, I think it's in an upcoming slide. Let me look really quickly. Oh, I deleted the slide. Excuse me. The numbers of the majority of the people that get the greatest amount of antibiotic use are children under the age of 10, with more than 50% being under the age of 6. And the research is so clear of how devastating it can be to a developing microbiome to wipe it out when they're under a year. And of course, I'm sure you've probably looked and you've seen there is a lot of research and a lot of questions out there to say, is it really appropriate to be dispensing antibiotics to children under 1 year of age? And of course, you and I both know the immune system isn't even really on its way to becoming developed until 18 months. And so it starts to wipe out what good is trying to grow and develop, and it actually really creates severe compromise for our children and for all of us. So the moment we take those antibiotics, they're wiping out the good and the bad, or the bad and the good, right? And so now we start to think about, okay, if we are what we eat, we are what we absorb, and each bite moves us closer to sickness or to health, why are we so sick? Well, again, what's happening is we're wiping out these very beneficial bacteria from our overuse of antibiotics. And this is just one thing. There are many other things that cause disruption. I'm going to say that again to this microbiome, but that's a huge culprit. And so we're now no longer able, with that leaky gut, with that impaired terrain, to appropriately digest, assimilate, and eliminate nutrients and toxins. So our system now becomes this vicious cycle of intestinal inflammation. Everything's inflamed, nothing can be absorbed. So now we've got nutrient malabsorption. We've got an immune response because there's this hyperinflammatory. So we've got a hyper-responsive immune system. We've got leaky gut. Things are getting out to the circulatory system. So now we've got this overdrive. The body is attacking cells. We're wearing down. Fatigue is setting in. And we're having GI issues. We're having multiple food intolerances. We're having skin issues. It's leading to autoimmune disease, and it goes around and around and around. And one of our good friends here in the Pneumatica family and opinion leaders, Dr. Tom O'Brien, he'll tell you the research, if you've ever listened to any of his presentations, if you've got one autoimmune, research shows you've got at least 3. And this is really ground zero for it, gang, of what's really going on there. So the question is for you as the practitioner, if you're not here to be a GI specialist, what do you do, right? Like, but Melissa, I'm doing acupuncture and this is so out of my wheelhouse. I just want to know some nutritional strategies to help my people. Well, you're in the right place, okay? So here's my take it if you like it, leave it if you don't. I believe for all of us, regardless of specialty type, we all have a commitment to our patients to do our best due diligence. And I'm big into, all forms of healing. But I do believe that at the most foundational level, we've got amazing advancements in diagnostic testing, and we should use them to our benefit and to our patients' benefit. Not to use the test in place of treatment, but we test so that we don't guess. We use the diagnostics to really understand the terrain so that we can make the most appropriate clinical recommendations, clinical nutritional recommendations to really get in. They allow us to target in on the deficiencies or the holes in the bucket, right? And they allow us to help our patients gain quicker corrective results. Hopefully that makes sense. Now, I want to tell you, at our Functional Medicine Practice Accelerator one-day seminar series, which is going to be in Chicago in October, Charlotte in November, we're going to be in Texas, we're going to be on the West Coast. We'll give you more information about that coming up. But Savio Diagnostics is one of our partners in this the seminar, just like Pneumatica is. And one of the leading national educators, Dr. Katani, is going to be speaking in depth about the microbiome and about really amazing advancements in diagnostic testing. I brought this one particular test up because it's really relevant. And when it comes to testing, we can all go far down the rabbit hole and get really overwhelmed. What do I do? What don't I do? How do I take care of this? How do I take care of that? And there's a ton out there. But if we want to just look at some of the literature and say, where can we do the greatest good? Researchers have identified a protein called zonulin. And this protein is shown to increase intestinal permeability. What is intestinal permeability? AKA leaky gut. Okay, so how do we know for sure if we've got leaky gut? You can run a zonulin test. I'm going to tell you, I also ran a SIG-A. I would always run that as well, because if we've got high levels of intestinal inflammation, then you have got, well, high is going to be acute, but when we have depressed levels, that's when it's chronic. And if it's been going on for a long period of time, you better believe there's a real high correlation to leaky gut or intestinal permeability. So we want to look, because what research is showing is that increased intestinal permeability is found in almost all cases of autoimmune disease, celiac disease, type 1 diabetes, multiple sclerosis. Of course, we know these are all autoimmune, right? Rheumatoid, inflammatory bowel disease. So they're all characterized by abnormally high levels of zonulin, and because that produces a leaky gut. So here's the reality. I showed this. We are what we eat, and most of our patients are eating like this over here on the left: French fries, burgers. Come on, isn't that the American diet? Well, if we want to start to change our patient's health, remember what's on the end of your fork. Because as I said in Module 1, what we put into our mouth is the most empowering thing that can evoke immediate change, because all of us are 3 times a day, if not more. So that's 3 opportunities to move closer to health and further away from disease. So you're changing who you are because we know that this signals the cell. It's talking to the body. It's impacting the microbiome. It's impacting the health and the function of your body. So who are they? What are they putting in? So now you're going, okay, well, gee, I know they're sick, or I know they've got problems. So now what do I do? So if you're in a practice, you're in a situation where you're able to actually do, or you already do diagnostic testing, then I always say start there. I say test, don't guess. Let's say you don't do diagnostic testing. Can you still help them? Absolutely can. 100% you can. So where does it start? Well, think back to webinar 1. It starts with the intake. It starts with your physical examination. It starts with your health history, your lifestyle, your assessment. You're looking, you're asking, you're determining. And you're finding they've got things from skin issues. That's going to be on that visual skin examination. We talked a lot about that last time. Okay, so you quickly issues, which is immediately cueing you into, we got stomach issues, stomach issues, stomach issues. Of course, there's going to be outward symptoms of gas and bloating and abdominal pain. You're going to see things on your health history like constipation or diarrhea or IBS, or they're going to already know that they've got a diagnosis of celiac or Crohn's. So some of this stuff is going to be right there in the paperwork. And now it's up to you to decide, what's the scope of my practice? How much or how little of this do I want to do? Do I want to actually create comprehensive programs? Do I really want to help to provide clinical nutritional and create greater correction? Or I don't have the staff, I don't have the time, but I just want something that can, move the dial in the positive direction. So I'm going to take you through I'm sure if you've ever done anything with the GI before, you've heard about this, and I'm going to bring up some of the research that shows the efficacy for why we pick what we pick. There's a couple, you can call it reduce, remove, replace. Some people go 3 hours, some go 4 hours. We're going 4 today. And step 1 is you always want to remove. I tell the patients, think of this like we got to put out the fire. So the GI is a mess. The microbiome is out of balance. They're fatigued. They're malabsorbed. Their blood work is all over the place. They're not getting right nutrients in. They have chronic skin problems, whatever they're presenting with. Step 1 is we have to get them out of crisis. So we want to remove as much of the irritation or the stress to the system as possible. Now, for many people, you can start with food, because what's the biggest source of stress to their system? It's the food that they're eating. Okay? It's the sodas they're drinking. It's the high carbohydrate, highly refined, sugary diets. It's lots of caffeine, because everybody's so tired that have these issues, okay, that they got microbiome issues. Remember, they're not producing key nutrients. Their cellular metabolism, their metabolic function is depressed when there's GI issues. So they're tired. So what do? They try to sleep, and then they try to wind it down at night, or they try to kind of numb their sadness because they're not making as much serotonin. They're drinking more alcohol. So we want to start just a standard elimination diet. So you're going to get rid of some of the big things like sugar and caffeine and gluten and dairy. You can do eggs, you can do soy. Depends on your scope, depends on your chrome, but that's a real typical beginning point. Now think about it. You've got to immediately get the bad stuff out, but you want to help to put the fire out. Of the liposomal version of the curcumin as the fire extinguisher, because we know from research that curcumin is an amazing anti-inflammatory, right? So it's going to immediately bring down the inflammatory process and immediately help to reduce the severity of their symptoms and help them to start feeling better. Now, a simple thing that you do is you can always recommend to them to drink bone broth. And I don't advise that it come out of a carton. I actually advise that they make it. I've got a whole recipe I always give to my patients. It's phenomenal with how it helps to heal that intestinal lining. Now, let's talk about healing that intestinal lining. So there's the natural way of something like bone broth, but most of the people coming into your practice, it's pretty chronic conditions. And this isn't just, it's the new year, I'm going to do a cleanse or a fast, or I'm going to just heal my gut for 2 weeks. No. Most of these people are really dealing with some issues, and most of these protocols are taking them of 4 weeks. In some cases, you're going to 12, depending on the severity. And so if you're doing any level of diagnostic testing, the dial isn't going to move by just taking the food out for a week and giving them some bone broth. You're going to have to go in there and actually do some corrective treatments. And this is why we call it clinical nutrition, because we're taking a clinical approach using natural ingredient supplementation to help improve and correct the internal physiology and conditions. So when we're repairing the lining of the GI, when we're helping to repair, if you will, to that entire microbial system, we want to focus on the lining of the GI. And of course, L-glutamine is absolutely clinically shown to help to heal that lining and help to kind of revivify, if you will, the tissue and strengthen those junctures again to reduce the likelihood of leaky gut. The threes, aloe vera, vitamin C, and zinc, these are all clinically shown to heal. And Glutamed, I love this product because we've already got several. We've got high doses of L-glutamine and aloe vera products. So it's so gentle, it's so healing. I literally just throw it, boom, right into my shake. So when they're doing their morning shake, I have them go ahead and add that straight in. So next we got to talk about, and this is where we get. So for those of you out there that are not running big, functional nutritional practices or functional medicine practices, and you don't have time for all of this, you want just one thing that you can take away from tonight's webinar, one thing that you can start to do for any of your patients with GI issues, then this is where you're going to look. You're going to look right here to probiotic. So pre and probiotics, and let's look at some of the literature. Okay, so I've got a few PubMed studies here for you guys. It's always a phenomenal resource. Probiotics can regulate intestinal immune response, increase the barrier function of epithelial cells. Okay, remember that's going to help with that leaky gut. It's going to inhibit the adhesion and colonization of pathogenic bacteria. That's the bad stuff. And thus restore and reconstruct normal intestinal flora. Great study on that one. Go ahead and read more about it. I know you will enjoy it. So here's another one. Probiotics, polyunsaturated fatty acids, and folic acids are 3 supplements that demonstrate the ability to target inflammation and other underlying systems in depression. So remember, the stomach is the second brain. It's where 95% of serotonin is made, right? So if we've got a disruption in that microbiome, we have got to get in there and help to restore order so that we can help to improve the overall symptomatology. Next, we've got some clinical trials that have assessed the therapeutic effects. So this is really key. There's so much research going on in probiotics alone, you guys. It's huge, okay? Because why? Because 4 out of 5 Americans are taking antibiotics, because we have superbugs out there, because nothing's working, because we have children. We have over 20 million children that are suffering from C. diff. We've got some real issues because of our overly prescribed antibiotic usage. Yes, there are times and places for it. And, I was talking to one of my friends who's an MD, and he said to me, he goes, Melissa, it's really hard. It's hard being the doctor when the parent is coming to you and they just want something. He goes, you wouldn't believe how much parents push us to write these scripts. So please know, it's not like the docs are the bad guy, it's all protocols, right? So just like I'm teaching you guys protocols for natural solutions, if you're an MD or a DO, you've been taught about protocols for antibiotics. And it's only, 2013, CDC itself starts to scream, whoa, we've got a real problem here. We're thinking that we're doing a little too much prescribing of antibiotics. And so, the red flags have just been waving. And so what I love is now there's more and more clinical trials that are assessing the therapeutic effects of probiotics. So we're seeing how it's working for several disorders like C. diff. We're seeing how it helps with diarrhea, irritable bowel, inflammatory bowel disease. So another really great research article. And what I want you to know is studies, because this is such a vast area of scientific research right now. The data is showing a huge range from 1 billion to 3.3 trillion as far as if we're talking about how do we dose, where do we start? So you're going to see some products out there that say 1 billion. You're going to see some that say 100 million. You're going to see some that say 5 billion. And the question is, where do you start? Well, I use Triflora myself. I use it on my family. I use it on my patients because it's a really sound place to begin. It's 20 billion. Now, one of the products, and I actually don't have it listed here, and you guys might know this, but the Glutenza or the Allergenza, it's both a pre and a probiotic, as well as it's got all the great enzymes to help to break down gluten and eggs and soy and dairy and all that good stuff. What I like about that one's only 5 billion. And so that's something I've actually used that in children, which it can still be a high dose with some children depending, but it's gentle enough. You can't just start a kid on 20 billion. It's too high of a dose. So if we're looking just in the Pneumatica family of what might be available to us, those are some things to think about. And I know that there's a really exciting new probiotic coming soon from our Pneumatica family also. So keep your eyes out for some really high clinical dosages coming your way. Now, there's natural solutions, right? It doesn't have to just be something in a bottle, but if we're dealing with clinical deficiencies, you've got to prescribe or recommend a clinical grade supplement, because just eating kimchi and yogurt alone is not going to do it. It's not going to reconstitute that area. Will it help? Yes. If you couple fermented foods with an elimination diet and with right strengths of clinical dosages of probiotics, then you're going to really have a beautiful result inside of that microbiome. And so we have found that when we can actually promote, and this is again in the literature, when we can promote the growth of good gut bacteria, it's not only caused the good bacteria to flourish, but it also caused the person to lose weight, to lower their blood pressure, lower their heart rate, and cholesterol levels. Because again, remember, the microbiome is really important. It plays a key role in healthy metabolic function. And if we think about metabolic function, that's all of this good stuff in bold, okay? So now the last R is replace. A lot of times when there's been high levels of inflammation, there's been high levels of breakdown, of poor digestion, then we don't have, and again, if people are eating a lot of food out of boxes, bags, and cans and drive-thrus, then they don't have the right balance of natural enzymes. Remember, enzymes are the lock and the key. The enzymes help to actually break down the food to release the nutrients to the body. Where are enzymes? They're in fresh, whole foods. Why do you think that we were all brought up to have a salad before dinner? Well, salad is a fresh, whole, live organism that when you chew it at least 20 times, you really get good digestion going, and it's the enzymes that are going to help the food that you eat next to be fully absorbed and assimilated, okay? So digestive enzymes, when we're in these clinical conditions, we need clinical grade supplements. If it's mild and you want to just start them on a whole food diet, nothing out of a box bag or a can, then okay. But I love the Pepsigen because it's got the digestive enzymes and the hydrochloric acids, and this is going to aid with optimal digestion. So guys, there's so many things going on, and we've got to look at the role. Remember, gut health starts in the gut microbiota. Here's another important thing. This is kind of a little side note. It's not part of the 4 R's. You can put it into your protocols if you want, but I do need you to know. We know that glutathione is one of the most powerful antioxidants in the body. We know it's absolutely essential in the role that it plays in liver metabolism, right? In breaking down foods and detoxification pathways, hormone regulation. It is so important, so essential in so many of these metabolic functions. Well, here's what we know. When the microbiome is out of balance, then it dysregulates the levels of glutathione, because a healthy microbiome produces healthy amounts of glutathione, okay? Unhealthy or imbalance will imbalance and decrease the amounts of glutathione. And we know that glutathione, it's absolutely beneficial in improving that overall terrain as well as overall metabolic function. So as I was saying, where we want to go next with this, guys, is really realizing it's all about having the right tools and systems so you can succeed. It's putting all of this together, because regardless if you're just looking for a single solution like a probiotic to a more comprehensive program where you want to go ahead and do the 4 R's, you want to offer 8 and 12-week completely corrective GI programs or other types of programs, if you're running more of a functional wellness or functional medicine practice, the choice is up to you, and you've really got all of this available at your fingertips. Now, if you are trying to put the pieces together, you are asking yourself those questions real time. Well, what do I want more of? What do I want less of? How do I see my practice and myself evolving? Then I want to personally invite you to realize that there are, first of all, there's holes in the bucket, and it's okay to ask questions. We've all got them. I've got them. It happens, and that's a normal part of the process. And it's about being willing to look within your practice and look within to say, okay, I know your clinical acumen's strong. And tonight, hopefully you gleaned a few more clinical pearls that you'll be able to implement and continue to improve what you're doing in your practice. But, for many of us, it's not so much the clinical area that we struggle. It's more of the business. It's the marketing. It's the sales cycles. It's the, how do I give myself a night off? When my to leave at 5, but how do I actually leave at 5? It's the questions that keep you up at night, like, How do I break free from insurance dependence because it's changing so much? How do I start to more cash services? And if I even knew how to do that, who do I need to hire? How do I ask for money? What systems do I need to be in place? How do I run membership services? Or how do I offer these comprehensive programs and actually have to take money? These are all holes in the bucket. These are opportunities. Now, a hole in a bucket doesn't mean that you're a sinking ship. I like to look at it as an opportunity growth for improvement so that you can continue to move forward. Remember, success leaves clues. So you get to ask yourself, what is it that I really want? What do I want more of? What do I want less of? And let me, where I can go get those answers. Because here's the thing, my friend. All of us are in this changing sea of healthcare. And while I know you're an amazing clinician, if you're looking to figure out some of those answers to those questions that you have on the business, on the marketing, on the sales side, on the systems, and the automation side, well, that's what the Practice Accelerator is all about. Now, we take you at this seminar from beginning and middle to end. We give you a complete foundation for a turnkey system. We teach you how to build your ideal practice. What is it that you want to put together in your care plans? We show you how to structure those. We show you how to bring in more cash-based services so that you're not as dependent on insurance reimbursements as they continue to change and decline over time. We teach you how to have a consultation, how to communicate effectively in a way that's driven psychologically to meet the need of your patient so that they say yes when it comes to actually paying out of pocket for services. We teach you how to put all of this together with the clinical foundation, with the testing that you need, with the products that you need, with the protocols that you need, and the additional ancillary support that you need, all wrapped up so that you can go back and you can plug and play and put this into practice in your business. Now, this helps every aspect, and it doesn't matter what type of specialty you are. I have MDs coming to me, I have DOs coming to me, I have NDs and chiros and acupuncturists and nurses and coaches. I've got so many people coming and saying, how do we navigate this terrain? And that's why we've developed this seminar. Myself, I've been in practice over 20 years. My co-educator, Dr. Ellie Campbell, she's been in practice she's a specialist in concierge medicine for over 25 years. And so together we really help all sides of this integrative health field on best business and clinical practices. So guys, listen, I want to go ahead and extend an invitation to you. This is not a sales, this is not a pitch, this is just a real-time invitation. If you want to come out and you want to be supported by a team of people that are going to discuss real best business practices, marketing and sales solutions, all wrapped around a clinical turnkey framework that you can plug and play into your practice from beginning to middle to end, then I want you to save yourself $150 and I want you to sign up now for the FM Practice Accelerator. So early bird pricing does absolutely 100% go away on September the 10th. Now, if you want to pay full price and you want us to take your money, we'll do it. But I'd like to save you some money. I'm here to help you build your business. And lesson number 1, low-hanging fruit, let's get rid of additional extra costs. If we don't need to pay higher rates for seminars, then don't. So go ahead and sign up now. Because between myself and Dr. Ellie, you've got over 25 years of shared experience in the integrative space, in cash and insurance-based practices, that we understand not just theory, but real-time best practices from not only our own, but myself of over a decade of consulting in a multitude of environments. I'm there to give you real answers. Really, like I said, success leaves clues. So to make it as easy and as streamlined and direct as possible for you. So when you go over to fmpracticeaccelerator.com, you're going to save $100. You get an extra $50 off when you use this code Numedica50 at the checkout. So make sure you go ahead and put that in, because guys, I want to see you over at Practice Accelerator. So I hope this was helpful, everybody. And I really want to thank you for taking the time tonight to be here, to continue to study, to learn, to grow, and to thrive yourself. So listen, if you need me at any time, I'm always over at functionalmedicineagency.com. I would absolutely love to see you at one of our full day live FM Practice Accelerator events. And you can click that link anytime. Take advantage of that code before September 10th so you can get that special savings. Now, if you have any questions tonight, I'm so sorry. It's laughable at this point. We've gone long. I want to get to your questions, so feel free just to fill them out in the chat box over here to the side, and those will be, directed right over to me. I'll get those answered for you in the most timely fashion as possible, because I really appreciate that you took time tonight to be here. And so as we wrap, thank you, my audience. Thank you, my Numedica family. I want to thank each and every one of you for continuing to just be the amazing you are, truly being a change out there in this integrative healthcare space, making a difference to provide greater health and greater well-being.